Okay, assalamualaikum. Okay, so today I and my friend we present about the hip joints. Okay, so let me introduce to my team members. Okay, my team is consists of 3 members. Okay, first we have Anis Fatmawati, Menti Nordin. The second one we have Azmira with Ibrahim, and the third one we have Nova Heza Miti Zakaria. Okay, so I will tell about what is the hip joints. Okay, hip joints is a joints that connects the thigh bone, that's mean our femur, to the pelvis. It's one of the largest bones in our bodies. Is also the body's largest weight-bearing joints and plays a crucial role in maintaining balance and stability while allowing for a wide range of motions. Okay, so the anatomical of hip joints. Okay, the hip joints, also known as the ball and socket synovial joint, is the crucial joints in the human body. It's because it enabling a wide range of motions and provide a stability. Okay, so um, in the hip joint, okay, we have bones. The bones is a femur and a pelvis. Okay, femur is the thigh bones that has a spherical head that fits into the acetabulum of the pelvis. Okay, pelvis is specifically is the we have a acetabulums that like a cup-shaped cavity on the lateral aspect of the pelvis that receive the head of the femur. So that means the femur bones is connected to the pelvis by the acetabulum. Okay, so that we have the articulation cartilage. Articulation cartilage is used for to covers the heads of the femur and the acetabulum, and is provide a smooth lubricated surface for the joint movement, so that we can move our hip smoothly. Okay, next we have the joint capsules. Okay, capsule is a strong fibrous capsule that encloses the joint and maintains stability while allowing the movements. Okay, next we have ligaments. Okay, so at the hip we have 4 ligaments. We have 4 important ligaments. Okay, the first one is the iliofemoral ligaments. It's a strong Y-shaped ligaments that located on the anterior side of the joint, and is preventing the hyper extensions. So next we have the pubofemoral ligaments. It's we can found it on the anterior and inferior aspects. It prevents excessive abductions and extension. Next we have the ischiofemoral ligaments. It's located posteriorly, and it limits internal rotations and adduction. Next we have the last one, we have the ligamentum teres, or ligaments of the head of the femur. It's a small ligament within the joints that provide some blood supply to the head of the femur. Okay, so at the hip joint also we have the muscles and tendons. Okay, the gluteal muscles is a muscles that we can find in the hip. Okay, it's including the gluteus maximus, medius, and the minimus, which are essential for movement and stability. Okay, next we have the iliopsoas. That means it's for a major flexor of the hip. And then we have the adductors. It's located in the middle thigh. They bring the leg towards the midline. And lastly, we have the hamstrings and quadriceps. It's involved in extending and flexing the leg at the hip joints. Okay, next we have our synovial joints. Synovial joint is for to lines the inner surface of the joint capsules, and it secretes synovial fluid for lubrications. Okay, and next we have a bursa. It's a small fluid-filled sacs that reduce frictions between structures. Important bursa in the hip include the trochanteric bursa and the iliopsoas bursa. Okay, next we have the blood supply. Okay, blood supply used to provide primarily by the middle and lateral circumflex-femoral arteries and the obturator artery, which ensure nutrient delivery to the hip joints. And lastly, we have the nerve supplies. The hip joint is innervated by branches from the femoral, obturator, and superior gluteal nerves, which relay sensory information and facilitate muscles control. So here I've include the pictures the anatomical of hip joints. Okay, so here we can see at the anterior view. Okay, we can see we have the iliofemoral ligaments that like Y shapes, and below that we have the iliopectineal bursa and next we have the pubofemoral ligaments, and then we have a bony structure that is the obturator crest, superior pubic ramus, and then at the femur head we have the lesser trochanter, intertrochanteric line, and at the femur also we have the greater trochanter. So at the posterior view we can see the iliofemoral ligaments, the ischiofemoral ligaments, zona orbicularis, and next we have the greater trochanter, intertrochanteric crest, lesser trochanter, and protrusions of synovial sac. And we have the ischial tuberosity and ischial spine. And so, and at the lateral view, okay, when we open the joint, okay, we can see at the pelvis bone, we can see we have our anterior superior iliac spine, and below that we have our anterior inferior iliac spines, and we also can see that we have a iliopubic eminence, acetabular labrum, and we have a fat in the acetabular fossa that is covered by the synovial membrane, and we have the obturator artery, anterior branch, posterior branch, and we have the acetabular artery, obturator membrane, transverse acetabular ligaments, ischial tuberosity, lesser trochanter. We also have the round ligaments, that's ligamentum capitis, femoris, at the acetabulum, and we can see also the intertrochanteric line, neck of femur, head of femur, greater trochanter, articular cartilage, and the last we also can see the lunate surface of the acetabulum. So next I will explain about the biomechanicals of the hip joints. So hip joints it give a range of motions. Okay, so we can we have flexions and extensions. That means the hip joints allow approximately 120 and to 230 degrees of flexions and 10 to 30 degrees of extensions, facilitated by the hip flexors and extensors. So next we have the abductions and adductions. It allows about 45 to 50 degrees of abductions and 20 to 30 degrees of adductions, controlled by the gluteal muscles and adductors. Next we also can rotate our hip. That means it permits around 45 degrees of internal and external rotations. It managed by the medials and lateral rotators. So next, hip joint also give a stability. So how this stability we can have? Okay, we can have this stability because of joint congruency. This means this spherical femoral head fits securely into the deep acetabulum, providing inherent stability. So next, we also have the ligaments. Ligaments are like the iliofemoral, pubofemoral, and ischiofemoral ligaments that reinforce the joint capsules, limiting excessive movements and preventing dislocations. Then we also have our muscles. Muscles is surrounding the surrounding muscles maintain this tension across the joint. Is contributing to the dynamic stability. Next is provide the load bearing capacity. The hip joints supports body weight during standing, walking, running, and other activities. The trabecular bone structure in the femoral head and the acetabulum is oriented to absorb and distribute compressive forces efficiently. Then the articular cartilage is give smooth, resilient surface. Is articular cartilage is the smooth, resilient and surface that's allow for even load distributions and shock absorptions, reducing stress on the underlying bone. So here I have forward videos. Okay, you can see there's a flexion extensions. Okay, how the our muscles is contract to and how it's connected to each other, how we can move our leg. So here I have forward videos. Okay, you can see there's a flexion extensions. Okay, how the our muscles is contract to and how it's connected to each other, how we can move our. Okay, so next I will explain about the relations of the hip joints. Okay, so at the anterior part, okay, we have the iliopsoas muscles. The iliopsoas tendons is passes anterior to the joints as it inserts into the lesser trochanter of the femur. Okay, the femoral nerve, artery, and vein. This structure is run medial to the iliopsoas muscles, and the pectineus muscles. This muscle is located medial to the iliopsoas tendon. So at the anterior part, we can see the iliopsoas muscles, the femoral nerve, artery, and vein, and the pectineus muscles is related to each other. So next, at the posterior part, okay, we can see we have the gluteus maximus muscles. Is the largest and the most superficial of the gluteal muscles. Is lying posterior to the hip joints. And at the posterior part also we have the sciatic nerve. Is the nerve that runs posteriorly and laterally to the hip joints. And we also have the piriformis muscles. These muscles also lies posterior to the joints and can be used as a landmark to locate the sciatic nerve. So at the superior part, okay, we have the gluteus medius and minimus muscles. These muscles are located superiorly and play a crucial role in stabilizing the pelvis during gait. Also, we have the tensor facile lateral muscles. It's positioned laterally and slightly superior, and is involved in hip abductions and stabilizations. So here I have provide the diagram of the how these muscle, tendons, the joint, and all the bones is related to each other. So next, we also have the so at the inferior part, okay. So at the inferior part we have the alterator externus and internus muscles. These muscles, along with the quadratus femoris, are found inferior to the hip joints and contribute to its lateral rotations. And we also have the adductor muscle group. These muscles are located medially and inferiorly, involved in adductions of the hip. So at the medial part, we have the obturator nerve, artery, and vein. These structures pass through the obturator foramen and lie medial to the hip joint. Adductor longus muscles also located at the medial part. Its positions medially to the joints and is part of the adductor muscles group. So lastly, at the lateral part, we have the greater trochanter. Is the bony prominence of the femur. We can palpate under the skins and serving as an attachment site for the several muscles, including the gluteus medius, gluteus minimus, and the lateral rotators of the hip. So that's for me. So my friends will continue to explain about the functions of the hips. Okay, so thank you.
Bismillahirrahmanirrahim. Assalamualaikum and hi. My name is Anis Fatmawati binti Nuruddin. So today I will present about the functions of hip. So the primary function of hip joint is to weight bear. There are numbers of factors that act to increase the stability of the joint. The first structure is the acetabulum. It is deep and encompasses nearly all over the head of femur. This decreases the probability of the head slipping out of the acetabulum, or what we call is dislocation. There is a horseshoe shape fibrocartilaginous ring around the acetabulum which increases its depth, known as acetabular labyrinth. The increase in depth provides a larger articular surface, further improving the stability of the joint. The iliofemoral, pubofemoral, and ischiofemoral ligaments are very strong and, along with the thickened joint capsule, provide a large degree of stability. These ligaments have a unique spiral orientation and it causes them to become tighter when the joint is extended. In addition, the muscles and ligaments work in a reciprocal fashion at the hip. As we can see, on the anteriorly, where the ligaments are strongest, the medial flexor located anteriorly are fewer and weaker. On the posterior, where the ligaments are the weakest, the medial rotator are greater in number and stronger. They effectively pull the head of femur into the acetabulum. Okay, next we move to the next part, which is muscles that involve in the hip functions. So the first one is the hip flexion, the movement of the hip joint that brings the knee toward the chest, reducing the angle between the femur and the pelvis. The muscles that involve is psoas major, iliacus, and rectus femoris, assisted by pectineus, tensor fasciae, and sartorius. Next is hip extension, the movement of the hip that straightens the hip, increase the angle between the femur and the pelvis. The muscles that are involved is gluteus medius and minimus, aid in moving the leg away from the body. So the third one is hip adduction. It is the movement of the hip joint that brings the leg towards the midline of the body and reducing the distance between the leg. The muscles that involve is adductor muscles, such as the adductor longus, which is it brings the leg toward the body. The next one is hip adduction, which is the movement of the hip joint that takes away the leg from the midline of the body and increasing the distance between the legs. The muscles that involve is gluteus medius and minimus, aid in moving the leg away from the body. The next one is hip internal rotation, which is the movement of the hip that rotates the leg inward, so the knee moves toward to the midline of the body. And the muscles that involve is tensor fasciae latae contribute to internal rotation of the hip, while the external rotation, which is the movement of the hip joint that rotates the leg outward, so the knee move away from the midline of the body. And the muscles that involve in this movement is piriformis and abductor internus. So my last part is the physiology of muscle contraction. So I will explain in a very simple one. So as we all know that muscle contraction occurs when a motor neuron signals a muscle fiber to contract. The process will begin at the neuromuscular junction where the motor neuron meets the muscle fiber. So the first step is signal initiation. The motor neuron releases the neurotransmitter acetylcholine, and this neurotransmitter acetylcholine depolarize the muscle fiber membrane, leading to an action potential, and this will spread including through T-tubules. Calcium ions are released from the sarcoplasmic reticulum. So the second one, the cross bridge formation, which is the myosin heads bind to actin, forming cross bridges. ATP provides energy for cross bridge cycling, and actin filaments slide past myosin filaments, shortening the sarcomeres. The third process is muscle shortening. As long as calcium remains available and ATP is present, the muscle fiber continues to shorten. Troponin keeps actin binding sites unshielded for cross bridging. The last phase for this physiology is relaxation. It is when the signaling from the motor neuron ends, the sarcolemma repolarize, voltage-gated calcium channels in the sarcoplasmic reticulum close, and the calcium ions are pumped back in the sarcoplasmic reticulum. Muscle contraction stop when ATP is depleted or due to fatigue. So, the hip extensor muscle play a crucial role in hip movement and stability. They generate significant torque across hip joint, allowing actions like pushing off into a sprint or arising from a deep squat.
Hi, hello. Okay, this is the sketch of diagram of hip. On the right side, we can see there's a ilium, a head of femur. There's also greater trochanter. We can see here the iliofemoral ligament. And here you can see the femur. And we go the other side, there's a lesser trochanter. As you can see there, is also ischium. There's the obturator foramen, and inside the obturator foramen there is obturator membrane. Above the ischium, there's a pubocapsular ligament, and there's a next to it there's a pubofemoral ligament. So we also can see here is a pubis. There's a image of a cotyloid ligament and also the synovial membrane. We go to the next slide. This is also a diagram of hip. You can see clear view. This is the anatomy of epi hip. It contains acetabulum. You can see here a femoral head. This is also clear view of greater trochanter. This is a part of quadrate tubercle. Okay, we can see also here the femoral neck. Down the femoral neck is lesser trochanter and there's femur. Okay, we go for the radiograph for hip. The radiograph for hip, actually, we can see the hip view, which is anterior, posterior, the lateral, the horizontal view, lateral. There's a special view, Clemens Nakayama view, and also there's another one called dot view. So we go for the basic view. This is also represent as AP hip. You can see clearly the image of anterior inferior iliac spine, neck of femur, greater trochanter. There's an trochanteric ridge. Down here is a lesser trochanter. You can see the shaft of femur. So we could do up here. There's ilium. There's a pelvic rim, and down there there's a roof of acetabulum, and then the fovea centralis, and there is a place we call teardrops. There is a superior pubic ramus. We can see clear is ischium, isoppubic ramus, and we can see the skin's crease. The next slide is lateral projection here. There is we can see obviously anterior superior iliac spine, the ilium, the anterior inferior iliac spine, acetabulum, ischial spine, also greater trochanter, the shaft of femur, the lesser trochanter, the pubic rami, the ischium, and we can see also the pelvic lid. And the last one is the true lateral fib, and also we can call as horizontal beam projection. So you can see clearly view of shaft of femur, neck of femur, the greater trochanter, the pubic, the anterior inferior iliac spine, and also this is the lesser trochanter, ischial tuberosity, articular surface of acetabulum, and articular surface of femoral head.